Good evening, everybody. This is Brittany Casillas with Right at Home Healthcare, bringing you guys a PowerPoint presentation. Today, I'd like to talk to you guys about the care of the dying patient. So, I'm going to share my screen and start this presentation. All right, today's topic is care of the dying patient. So, several weeks ago, I was able to visit a client's home, and that client was also receiving services from hospice care. So, then I thought about how I could make this into an education piece for you guys. And realizing that some of your clients do have hospice services, I just felt like it was a good idea for us to talk about some things so you guys felt more comfortable in homes with clients who are receiving this care and just different ways that we can help these clients and make their situation better, be helpful to hospice, help with the family, and just maybe become a little bit more familiar with terms and different things that hospice clients have different versus clients who are rehabbing or clients who are just long-term clients of ours that need our assistance with their ADLs. So end of life care. So when we take care of someone at the end of their life, it's a very rewarding experience. Hospice services, to explain what hospice services are specialized teams, and they typically have nurses and doctors that come in and see the client in their homes. They monitor their progress. They're able to treat them with different medications, and there's different ways to administer them so that it's easier for the client. This is to make them as comfortable as possible. The goal for hospice care is to give everyone a dignified death. And while we are not hospice care, we do take care of plenty of clients who are under the care of hospice. And we kind of can work together with the hospice team to provide care for clients, to help them with their physical needs, emotional needs. We can help the family as well. When we are going in these clients' homes, we are helping reduce stress on the family by just being there and being able to take care of their activities of daily living. And that kind of gives the family a little bit of a break, which is nice, because it's stressful enough to have a family member that you're taking care of in your home all the time. For these families, it's also extremely stressful when you know that that family member is passing away. So everyone deserves a break. We're here to help with that, and we're also there to help with the client and make sure that their needs are being met, and we're doing everything possible to help them ease into that transition. So there's different physical signs when someone is actively dying that I feel like we should all be familiar with. And if you are familiar with these things, great. If you're not familiar with these things, these are going to be some new terms. Um, I know hospice care, a lot of times they come in at different times of the day, and they may very well have a hospice nurse that comes in during a shift that you're working, and they may start talking to you about different things, asking you different questions. So it's just really important for us to know some basic terms, and understand what's going on with the client. So, one of the physical signs to expect is they can become very restless, confused, or agitated easily. Um, if this is an acute problem, which means it is happening, it hasn't been going on throughout your shift, they all of a sudden become super agitated or restless. This is something that I would probably talk to the family about, or if the hospice nurse is there, talk to them about. They may need some pain medication or something. Like we talked about before, we always look at our basic needs first. And that could be they need to be changed, they need to be repositioned. Pain is also a basic need, pain control, especially with clients that are actively dying. So if there's something that they need, we just want to make sure that we facilitate um, letting someone know, making someone aware so that they can be helped. They tend to sleep more. They're very drowsy. Their bodies are wearing down. So, um, less blood supply is going to organs. It's kind of staying close to the vital organs at this point. Um, this can cause someone to be very drowsy, and that's okay. We just let them sleep as long as they're comfortable. Loss of appetite. Eventually, they'll stop eating and drinking. If they make it far enough into this process, they kind of lose the ability to swallow and things like that. So, if you notice someone's choking or you don't feel comfortable giving someone a drink of water or something to eat because you feel like they're aspirating, that's another one of those words we've talked about before in an education video. Aspiration, of course, is when uh, food or water boluses are going into the airway and not in their esophagus. So if we suspect that, it's okay to not feel comfortable continuing that. If the family wants to continue that, that's on them, but we certainly don't want to pose any more of a problem with the client than they've already are experiencing. They can have irregular breathing patterns or pauses in breath. The pauses are called apnea. I don't know if you guys are familiar with sleep apnea. That's when someone is sleeping and they kind of take a deep breath and then they kind of pause and quit breathing. Babies do this sometimes. In infants, it's actually totally normal a lot of the time when they're first out of the womb. But this irregular breathing pattern does happen whenever someone is getting closer to death, and it's called apnea. So that's a word that I hope you guys can put in your vocabulary. Swelling, coldness, or blue coloring to the hands and feet. This is called mottling. A lot of nurses will, when someone is actively dying, if you've noticed a hospice nurse come in, they kind of pull the covers up and they'll look at their feet, or they'll just take a look at their hands, and they may even mention, oh, they're mottling. That is happening because, like we talked about earlier, the blood supply is kind of staying towards the vital organs at this point. So anything that it feels is unnecessary, the body is kind of shunting that blood away from it. So hands and feet are going to turn blue. They're not getting proper circulation at that point, and that is a sign that you know someone is getting near to the end. Gurgling and crackling with their breath. Um, Nurses chart these sounds as different, breathing patterns. But basically, what you guys need to know is the gurgling and crackling. What's happening is um, as we all have mucus in our airway, and we're healthy beings, so we're able to clear our airway and cough and expel that sputum. As they're getting near to death, those muscles become weak as well, so they're unable to maintain a clear airway. They can see people that are not present or talk to them. I have seen plenty of clients start mumbling or talking. They kind of look up at the ceiling, or they kind of look at like they're looking at someone, but someone's not there. This is a normal occurrence when someone is actively dying. So, how can we provide comfort as caregivers? So, if we have someone that's no longer eating or drinking, They have oral swabs. You may have seen these in some people's homes. A lot of times, hospice care brings these in, provides these for these clients. You can put a little bit of water on them, make sure that you squeeze out all the excess water, but you can kind of put it in their mouth and keep their tongue moist. All the mucous membranes from the breathing patterns that they're having, not able to eat and drink, different things that are going on with their body, I'm sorry, mucous membranes are drying out. And even though um, that also just adds to their pain level. It's very painful whenever we have dry, cracked lips. So we can also put petroleum based lip balm on their lips, just anything we can do to kind of keep their mucous membranes moist. That's going to prevent pain. You can use a damp, cool compress on the forehead if they start to run a fever. Um, One of the other signs of passing away is a lot of people will run fevers. And a lot of times we can't get that fever to break. They'll just run a low grade temperature. Um, we can remove excess covers if they're too hot. We can do a cool compress on the forehead. These are all things that can just make them more comfortable. If they continue to have labored breathing, if they're laying in the bed, sometimes we can kind of reposition them, maybe put an extra pillow under their head, maybe slightly shift them on their side a little bit. This can ease with the breathing pattern. Like we had talked about before, all those muscles become weak. The muscles that hold the tongue become weak. So that tongue can kind of flap back a little bit, makes it a little bit harder for them to breathe. So um, oftentimes, if we can just reposition them a little bit, they may breathe with a little bit more ease. That's going to be more comfortable for them. We want to apply lotions to dry skin and reposition the client gently to prevent skin tears. So, like we had talked about, they may not be eating and drinking anymore. Well, when you're not eating and drinking, you're not getting the fluids that your skin needs to maintain its integrity. You're also not getting proteins and vitamins and minerals that your body needs to have uh, appropriate skin turgor. Um, and the drying of the skin, all of that can lead to the skin becoming very, very fragile. So we want to make sure that we are very cautious when we reposition these clients. Try not to put hands on skin. If there's draw sheets that we can use, we want to use draw sheets. If you do have to touch the client's skin, be careful of bony prominences. Don't like when you're trying to put someone on their side, it's best to put hand on the hip, not close to the buttock, because you don't want to cause a gluteal tear. And that is when basically the skin in their bottom just tears from in between their buttocks. That can happen whenever you're repositioning them. And then we're applying barrier creams and different lotions also to help with moisture. Like we talked about, dry skin can be painful, so we want to use creams. Keeping briefs and incontinence pads clean and dry. Like always, we want to keep our clients clean and dry. That's going to prevent skin breakdown, and especially with clients whose skin is probably already compromised due to their situation, due to actively dying, we want to make sure they're clean and dry. We want to speak calmly and reassuring. We can hold their hand. We always want to tell them what we're doing before we do it, even if the client seems like they're unconscious. Just because their eyes aren't moving, they don't seem to pay attention to us in the room, does not mean that they can't hear and feel what's going on with them. So we want to make sure that we always tell them what we're doing before we perform any task for them. So this slide's about pain. Due to the responses of the body dying, they can have pain from even light touches of the skin, and even heavy covers could bother them. Um, that just goes to show you how sensitive those nerves and things in our body become when we are in the stages of death. So we just have to be very, very cautious and careful when we're repositioning somebody. Um, if the covers might, we want to be checking skin. We always want to assess skin when we're repositioning, changing, anything like that, because it says even heavy covers could bother them. What can happen is heavy covers, if it's too tightly on the toes, it can cause skin breakdown there. I've seen that happen. And we certainly don't want to cause any more skin breakdown, any more pain when someone is actively dying. The slide also talks about sometimes we want to do more for our client. Sometimes you have a list of tasks that need to be performed on our client while we're there. And sometimes, if a client is in pain, especially if they're actively dying, sometimes it's okay to not perform every single task every single time. You just kind of have to gauge what's appropriate. We don't want to cause them unnecessary pain. However, we want to do as much as we can for them because keeping them clean and dry, keeping them repositioned, those types of things are going to prevent even further pain. Um, but you just kind of have to gauge that situation, and it totally depends on where your client's at in that moment. And just because someone's actively dying doesn't mean that they still don't sometimes have good days. And if they're having a good day, maybe that means you take that extra initiative and do a little bit more. Because if they don't have a good day tomorrow, then maybe they end up not getting bathed. But at least on your shift, you were able to perform that task. This is acceptable to not perform every task every time, depending on the client's pain level and what exactly is going on with them. However, you don't want to just make it seem like, oh, I didn't do this task. There's a reason you didn't perform it, and you kind of want to, if there is a place where you can comment on a task, why it's not performed, I would put, client did not tolerate it this time, or something to that effect, because you definitely don't want it to look like you just didn't do it. So give a reason why. And not only are we caring for the client, we have to remember that we are caring for the family as well. Um, the client is our first priority, but family comes very close second with this situation, especially. So whenever we're providing care for a client, we have to remember that this is such a stressful situation in these families' lives. And we have to make sure that um, we are patient with them just as we are patient with our client, and understand sometimes ugly things can be said. Um, People can be condescending to caregivers, and can sometimes just say little nasty things that are kind of hurtful to us. But we have to kind of be the bigger person in that situation. I'm not saying take abuse, but what I am saying is be a little bit understanding in the situation. Think about how you would feel if your family member was living with you and they were actively dying. it's it's stressful mentally, it's stressful physically. So just try to remember to have patience with the families during this time. We want to allow privacy with the family and the client if it seems appropriate. You know, a lot of times when we have clients that are dying, they may have family that come in from out of town that would like to sit with them. Maybe they want to speak privately about some things. It's okay to kind of go in the other room and give them their space. You know, check on the client, make sure they have all their needs met. But We definitely want to provide them with privacy. This may be some of the last moments they have with their family. So um, we just have to be mindful of that. And active listening. So families, may come to us with concerns and um, different questions, and maybe we're not able to answer those questions, but if you know that the client is under hospice care and those seem like questions appropriate for the hospice care team, you can kind of redirect the family and say, well, I'm sorry, I'm not able to answer that for you, but the hospice care team should be able to answer that for you. Just and listening, just honestly, sometimes family members just need an ear. Sometimes we're just that ear that needs to be lended at that time. So, just like we talked about being patient with them, active listening goes such a long way. They want to be heard. Sometimes you just got to voice your frustrations, and um, that is, part of a caregiver's job. We take care of so many aspects of our clients' care, and as well as their families. So thank you guys for all you do. This is my name, Brittany Casillas, my phone number, my personal email. If you guys have any questions, feel free to call or text me anytime, not just having to deal with this presentation, but if there's other things that you maybe have questions about in your home regarding caregiver skills, what you feel like is appropriate, what may not be appropriate, anything like that, feel free to call or text me. I appreciate everything you guys do, and I look forward to making more videos with you guys. Thank you.